Hi everyone, I am Professor Sungwan. This is the last lecture for medical terminology. So medical terminology 5. Today I'm going to talk about chapter 13, nervous system. Key terms: blood-brain barrier. Its abbreviation is BBB. This is the mechanism that blocks specific substances found in the bloodstream from entering the brain. Cell body is the division of a neuron that includes the nucleus, cell organelles, and surrounding cytoplasm, but does not include the axon or dendrites. Motor neuron is the neuron that transmits impulses from the central nervous system, brain or spinal cord, to a muscle or gland. It is also called efferent neuron. Nervous impulse is the physiological change transmitted through certain tissues, especially nerve fibers and muscles, resulting in activity or inhibition. Neurology is the branch of medicine concerned with diagnosis and treatment of disorders of the nervous system. Neurotransmitter is the chemical substance that transmits or inhibits nerve impulses at a synapse. Organelle is a cytoplasm structure that provides specialized function for the cell. Psychiatry, psych means mind, iatry means medicine or treatment. So psychiatry is the branch of medicine concerned with the diagnosis and treatment of mental disorders. Sensory neuron is the neuron that transmits impulses from receptors in the skin, sense organs, and internal organs to the central nervous system, brain or spinal cord. This is also called afferent neuron or afferent neuron. Synapse is a junction where a nerve impulse passes from an axon terminal to a neuron, muscle cell, or gland cell. Now, anatomy and physiology. The nervous system is one of the most complicated systems of the body in both structure and function. The nervous system senses physical and chemical changes in the internal and external environments and processes them and then responds to maintain homeostasis. Voluntary activities such as walking and talking and involuntary activities such as digestion and circulation are coordinated, regulated, and integrated by the nervous system. The entire neural network of the body relies on the transmission of electrochemical impulses. Impulses travel from cell to cell as they convey information from one area of the body to another. The speed at which this occurs is almost instantaneous, thus providing an immediate response to change. The cellular structure of the nervous system is composed of only two principal types of cells, neurons and neuroglia. Neurons are the cells that transmit impulses, commonly identified by the direction the impulse travels. There are two types, neurons. Sensory neurons, aka afferent nerves, transmit stimuli to the brain and spinal cord. On the contrary, the motor neurons, aka efferent nerves, transmit impulses from the brain or spinal cord to muscles and glands. Most nerves are composed of both afferent and efferent fibers, and thus they are called mixed nerves. Neuroglia or neuroglia, the cells that support neurons and bind them to other tissues, also play an important role when the nervous system suffers an injury or infection. There are three major structures of the neuron: cell body, dendrites, and the axon. The cell body is the enlarged structure of the neuron that contains the nucleus of the cell and various organelles. The dendrites are the cell's body's branching cytoplasmic projections. The dendrites carry impulses to the cell body. They resemble tiny branches on a tree, providing additional surface area for receiving impulses from other neurons. The axon carries impulses from the cell body. It is the long single projection ranging from a few millimeters to more than a meter in length. The axons transmit impulses to muscles, glands, and other dendrites. First, neurons. Myelin sheath. This is a white lipoid covering that many axons in both the peripheral nervous system and the autonomic nervous system possess. The myelin sheath acts as an electrical insulator that reduces the possibility of an impulse stimulating adjacent nerves. It also accelerates impulse transmission through the axon. The myelin that covers axons in the brain and spinal cord gives these structures a white appearance and constitutes the white matter of the central nervous system. Unmyelinated fibers, dendrites, and nerve cell bodies make up the gray matter of the brain and spinal cord. The Shubin cell is a neuroglial cell that wraps tightly around the axon, forming the myelin sheath on peripheral lobes. The Shubin cell forms a thin cellular membrane called neurolemma or neurolemma. The node of Rambier is the space between adjacent Shubin cells. It helps maintain the electrical potentials needed for impulse conduction. Neurons are not continuous with one another, so there is synapse. This is a small space found between the axon terminal of one neuron and the dendrite of another. For an impulse to travel from neuron to neuron, it must cross the synapse. The neurotransmitter is a chemical substance released at the end of the axon. It is caused by the impulse within the neuron. The neurotransmitter diffuses across the synapse to receptor sites on the dendrite of the next neuron. Here it generates the next electrical stimulus. The receiving neuron immediately inactivates the neurotransmitter, thereby preventing an unwanted continued stimulation, and prepares the site for another stimulus by a neurotransmitter. Thus, impulses travel through neural pathways. Neuroglia. It literally means nerve glue. Once it is believed that it served only a supporting role for neurons. However, it performs many functions. There are 4 types of neuroglia: astrocytes, oligodendrocytes, microglia, and ependymal. Astrocytes. This is the star-shaped neuroglia. The astrocytes provide 3-dimensional mechanical support for neurons and form tight sheaths around the capillaries of the brain. These sheaths provide an obstruction called the BBB, blood-brain barrier, that keeps large molecular substances from entering the delicate tissue of the brain. Even so, small molecules such as water, carbon dioxide, oxygen, and alcohol readily pass from blood vessels through the barrier and enter the interstitial spaces of the brain. researchers must take the blood-brain barrier into consideration when developing drugs for treatment of brain disorders. Oligodendrocytes, aka oligodendroglia. They help in the development of myelin on neurons of the central nervous system. Microglia is the smallest of the neuroglia. And they possess phagocytic properties and may become very active during times of infection. Ependymal. They are ciliated cells that line fluid-filled cavities of the central nervous system, especially the ventricles of the brain. They assist in cerebrospinal fluid (CSF) circulation. This figure shows the neuron. A shows the Shubin cell, and B shows the axon terminal synapses. Here, number 1, you can see the cell body, and inside the cell body there is a nucleus, and the cell body has many dendrites, and also you can see a long dendrite, which is an axon. An axon composed of neural lemma, Shubin cell nucleus, and the Shubin cell. And also you can see the myelin sheath surrounding the axon. And also you can see the node of Rambier in the axon. And the axon terminal, you can see the synapse. And in the synapse, you can see the axon terminal and synaptic bulb and synapse. This is the space, which is a synapse. And also you can see the dendrite of receiving neuron. And also there are many receptor sites. And there are two main divisions in the nervous system. The central nervous system, CNS, and the peripheral nervous system, PNS. The CNS consists of the brain and spinal cord. The PNS, the peripheral nervous system, consists of 12 pairs of cranial nerves, which emerge from the base of the skull, and 31 pairs of spinal nerves, which emerge from the spinal cord. This table shows the nervous system divisions and functions. There are two divisions, the central nervous system and the peripheral nervous system. In the central nervous system, there are the brain and the spinal cord. And in the peripheral nervous system, you can see the cranial nerves, spinal nerves, somatic nerves, and also autonomic nerves. Among the autonomic nervous systems, there are two types, sympathetic and parasympathetic. First, the central nervous system. This consists of the brain and the spinal cord, which are enclosed within 3 protective membranes called the meninges. The brain is one of the largest organs of the body and highly complex in structure and function. The brain integrates almost every physical and mental activity of the body. The brain is the center for memory, emotion, thought, judgment, reasoning, and consciousness. The brain is composed of 4 major structures: the cerebrum, cerebellum, the encephalon, and the brainstem. This figure shows the brain structures. Number 1 is the cerebrum, and number 2, the corpus callosum. And you can see the choroid plexus in the 3rd ventricle, and in the center you can see the encephalon, which is composed of thalamus and hypothalamus. And also there is the midbrain, which is called the mesencephalon. and in the lower part you can see the pons, medulla, and the spinal cord. And in the posterior part there is a cerebellum. And when we look at from the left, you can see the several lobes: frontal lobe, parietal lobe, occipital lobe, and temporal lobe, and the cerebellum. First, the cerebrum is the largest and the uppermost portion of the brain. The cerebrum consists of two hemispheres divided by a deep longitudinal fissure or groove. The fissure does not completely separate the hemispheres. A structure called the corpus callosum joins these hemispheres, permitting communication between the right and left sides of the brain. There are 5 lobes of each hemisphere. The 4 of these lobes are named for the bones that lie directly above them: frontal lobe, parietal lobe, temporal lobe, and occipital lobe. The 5th lobe is hidden from view and can be seen only upon dissection, which is the insula. It is not shown in the figure. Gyri are numerous folds or convolutions forming the cerebral surface. They are separated by furrows or fissures called sulci. The singular form is sulcus. Cerebral cortex is a thin gray layer which covers the entire cerebrum. It is composed of millions of cell bodies, which gives in its gray color. The white matter primarily forms the remainder of the cerebrum, myelinated axons. There are major functions of the cerebrum, like sensory perception and interpretation, language, voluntary movement, and the emotional aspects of behavior and memory. Cerebellum is the second largest part of the brain. It occupies the posterior portion of the brain. All functions involve movement. When the cerebrum initiates muscular movement, the cerebellum coordinates and refines it. The cerebellum also aids in maintaining equilibrium and balance. The diencephalon interbrain is composed of many smaller structures, 2 of which are the thalamus and the hypothalamus. The thalamus receives all sensory stimuli except olfactory stimuli and processes and transmits them to the cerebral cortex. It also receives impulses from the cerebrum and relays them to efferent nerves. The hypothalamus integrates autonomic nerve impulses, regulates body temperature, and controls endocrine functions. The brainstem completes the last major section of the brain. There are 3 structures in the brainstem: the midbrain, mesencephalon, separating the cerebrum from the brainstem; the medulla, which attaches to the spinal cord; and the pons or bridge, connecting the midbrain to the medulla. It is a pathway for impulse conduction between the brain and the spinal cord, the origin of 10 of the 12 pairs of cranial nerves, and it controls respiration, blood pressure, and the heart rate. Because the brain stem is the site that controls the beginning of life, the initiation of the beating heart in a fetus, and the end of life, the cessation of respiration and heart activity, it is sometimes called the primary brain. And now, the spinal cord. It transmits sensory impulses from the body to the brain and motor impulses from the brain to muscles and organs of the body. The sensory nerve tracts are called the ascending tracts because the direction of the impulse is upward. The motor nerve tracts, they are called the descending tracts because they carry impulses in a downward direction to muscles and organs. Is an inner gray area. An inner gray area is composed of cell bodies and dendrites, and the white outer is composed of myelinated tissue of the ascending and descending tracts. The spinal cord is located within the spinal cavity of the vertebral column, with spinal nerves exiting between the intervertebral spaces throughout almost the entire length of the spinal column. Unlike the cranial nerves, which have specific names, the spinal nerves are identified by the region of the vertebral column from which they exit. Meninges, singular meninges. The brain and the spinal cord receive limited protection from three coverings. They are meninges: dura mater, arachnoid, and pia mater. Dura mater, the outermost covering. Dura mater is tough. Fibrous and composed primarily of connective tissue. Venous is a cavity called the subdural space filled with serous fluid. The arachnoid is the middle covering. It has a spider web appearance, as its name suggests. A subarachnoid space contains CSF, cerebrospinal fluid, that provides additional protection for the brain and spinal cord by acting as a shock absorber. Pia mater is the innermost covering of the meninges. It contains numerous blood vessels and lymphatics that nourish the underlying disease tissues. And now I'm going to talk about the peripheral nervous system, PNS. The PNS is composed of all nervous tissue located outside of the spinal column and skull. The PNS includes 12 pairs of cranial nerves that carry impulses to and from the brain and 31 pairs of spinal nerves that carry impulses to and from the spinal cord. And functionally, the peripheral nervous system can be subdivided into two specialized systems: somatic nervous system, SNS, and autonomic nervous system, ANS. The cranial nerves are designated by name or number. They consist of fibers that may serve a sensory or motor function, or a mixture of both. Sensory nerves receive impulses from the sense organs, including the eyes, ears, nose, tongue, and skin, and transmit them to the CNS, aka afferent nerves. The motor nerves conduct impulses away from the CNS, efferent nerves. They conduct impulses to muscles, causing them to contract, or to glands, causing them to secrete. The mixed nerves are composed of both sensory and motor fibers. For example, the facial nerve acts in a motor capacity by transmitting impulses for smiling or frowning. However, it also acts in a sensory capacity by transmitting taste impulses from the tongue to the brain. This figure shows the cranial nerve distribution. Okay. Number 1, olfactory. Number 2, optic nerve. 3, oculomotor. 4, trochlear nerve. And 6, abducens nerve. And 5, trigeminal nerve. 7, facial nerve. 8. Vestibulocochlear nerve. And 9. Glossopharyngeal nerve. 10. Vagus nerve. 11. Accessory nerve. And lastly, 12. Hypoglossal nerve. The blue ones are efferent fibers, so they are motor nerves. And the red ones are afferent fibers, which are sensory nerves. The spinal nerves are all mixed nerves. 2 points of attachment to the spinal cord, an anterior root and the posterior root. The anterior root contains motor fibers. The posterior root contains sensory fibers. These two roots unite to form the spinal nerve. The somatic nervous system, SNS, primarily innervates, supplies with nerves, skeletal muscles, and it is associated with voluntary movement. The examples of voluntary movement include walking and talking. This figure shows the spinal nerves. So, the cervical nerves, thoracic nerves, lumbar nerves, sacral nerves, coccygeal nerves. And if we enlarge the specific area of the spinal cord, you can see the structures. Here, there are posterior roots and also anterior roots. And in the center, you can see the central canal of the spinal cord, and also you can see the gray matter in the center, and the peripheral area you can see the white matter. And there are several coverings: Pia Mater, arachnoid membrane, and dura mater. And the autonomic nervous system, ANS, innervates glands, smooth muscles, and cardiac muscles. They are involuntary because it operates without conscious control. The ANS includes digestion, heart contraction, and vasoconstriction. The sympathetic and parasympathetic systems in the ANS. To a large extent, these subdivisions oppose the action of the other, although in certain instances they may exhibit independent action. First, the sympathetic nerve fibers generally produce vasoconstriction, increased heart rate, elevated blood pressure, and slowing of gastrointestinal activity. They are evident in fight or flight situations, which means blood flow increases in skeletal muscles to prepare an individual to either fight or retreat from a threatening situation. The parasympathetic system generally transmits impulses that bring about vasodilation, a slower heart rate, a decrease in blood pressure, and a return to normal gastrointestinal activity. Now, I'm going to talk about medical word elements. Cerebral means cerebrum. Cranial means cranium, which is a skull. Dendro means tree. Encephalo means also brain. So encephalocele is the herniation of the brain. Ganglion means ganglion. Gli means glue. Glioma is the tumor composed of neuroglia or supporting tissue of the nervous system. Lex means word or phrase. So dyslexia means difficulty using and interpreting written forms of communication. Kines means movement. Bradykinesia means slow movement. Lepton means thin, slender. Manning or Mannings means meninges. Myelo means bone marrow or spinal cord. Poliomyelitis is inflammation of the gray matter of the spinal cord. Narc means stupor, numbness. So narcotic means relating to or producing stupor or sleep. Neuro means nerve. Strength means strength. Hyposthenia means the abnormal strength with excessive tension in all parts of the body. Radicule means nerve root. Thick means sheath. So intrathecal means pertaining to the space within a sheath, especially the meninges. Thalamus means thalamus. Tone means tension. Dystonia means any abnormality in muscle tone. Ventricular means ventricle. Algesia or algia means pain. Analgesia means absence of a normal sense of pain. Asthenia means weakness. So myasthenia is the muscular weakness and abnormal fatigue. Esthesia means feeling. Hyperesthesia means increased sensitivity to sensory stimuli such as pain and touch. Kinesia means movement. Hyperkinesia means increased muscular movement and physical activity. Lapse is the seizure. Epilepsy is any disorder characterized by recurrent seizures. Paresis means partial paralysis. Hemiparesis is the paralysis of one side of the body, which is also called hemiplegia. Aphasia means speech. Aphasia or aphasia means impairment in the ability to communicate through speech, writing, or signs because of the brain dysfunction. Plegia means also paralysis. Quadriplegia is the paralysis of all four extremities. Plexy means stroke. Ataxia means coordination. Ataxia is defective muscle coordination, especially when voluntary movements are attempted. Trophy is the development or nourishment. Dystrophy is the disorder caused by defective nutrition or metabolism. Contra means against. Contralateral means pertaining to opposite sides. Pachy means thick. Para means near, beside. Paraplegia is the paralysis of the lower part of the body and both legs. Syn means together, union. Uni means one. Unilateral means pertaining to or affecting only one side. Pathology. It is always essential to identify the neurological deficit as involving a muscle, a nerve, the spinal cord, or the brain. There are several common symptoms for many neurological disorders, like headache, insomnia, back or neck pain, weakness, and involuntary movement, dyskinesia. And muscle strength, coordination, gait, balance, and reflexes provide additional diagnostic clues. Lumbar punctures provide a sample of CSF, which is cerebrospinal fluid, for analysis and help identify various types of meningitis and encephalitis. Regarding radiology, especially CT and MRI scans provide detailed images that can locate several vascular irregularities, lesions, and tumors. Bell's palsy, a facial paralysis caused by a functional disorder of the seventh cranial nerve, and any or all of which branches, and Bell's palsy is associated with herpes virus. Bell's palsy may be unilateral, bilateral, transient, or permanent. There are several symptoms: weakness, which is asthenia, and numbness of the face, distortion of taste perception, facial disfigurement, and facial spasms. Dry cornea can occur because of an absent blink reflex, and it commonly leads to corneal infection, keratitis, and also speech difficulties, dysphagia, and pain behind the ear or in the face. The treatment for Bell's palsy includes anti-inflammatory drugs and the application of heat promote circulation and ease pain, and spontaneous recovery can be expected in about 3 to 5 weeks. Cerebrovascular disease. It refers to any functional abnormality of the cerebrum caused by disorders of the blood vessels of the brain. Most commonly, it is associated with a stroke. It is also called cerebral vascular accident, CVA. There are 3 major types of strokes: ischemic stroke, intracerebral hemorrhage, and subarachnoid hemorrhage. Ischemic stroke is the most common type. It is about 80% of all strokes. It is caused by a narrowing of the arteries of the brain or neck, generally due to arteriosclerosis. This narrowing causes insufficient oxygen delivery to the brain tissue, and within a few minutes, the tissue begins to die. Intracerebral hemorrhage is caused by the sudden rupture of an artery within the brain. After the rupture, released blood compresses brain structures and destroys them. Lastly, subarachnoid hemorrhage is commonly caused by a ruptured aneurysm, and it is usually fatal. There are several signs and symptoms of stroke. First, weakness in one half of the body, which is called hemiparesis, and paralysis in one half of the body, hemiplegia, and inability to speak, aphasia, lack of muscular coordination, ataxia, stupor, coma, or even death. Mild CVA patients experience a brief blackout, blurred vision, or dizziness, and it may be unaware of the minor stroke. So there is TIA, transient ischemic attack. Stroke symptoms that resolve within 24 hours. About 1/3 of all strokes are preceded by a TIA. A family history of cerebral vascular disease and high blood pressure appears to be a contributing factor to stroke. The treatment includes speech, physical, and occupational therapy, and various medications depending on the type of stroke. And also, there are seizure disorders. First, epilepsy. Chronic or recurring seizure disorders involve electrical disturbances, dysrhythmias, in the brain that result in abnormal, recurrent, and uncontrolled electrical discharges. The causes of epilepsy are brain injury, congenital anomalies, metabolic disorders, brain tumors, vascular disturbances, and genetic disorders. Seizures are characterized by sudden bursts of abnormal electrical activity in neurons, resulting in temporary changes in brain function. There are 2 major types of seizures: partial seizures or generalized seizures. The partial seizures involve a localized part of the brain, and also there are simple one versus complex one. And the generalized seizures involve the whole of both hemispheres. And also there is this disease, status epilepticus. This is a life-threatening emergency that involves the whole cortex. Status epilepticus is diagnosed when a continuous seizure occurs without a pause, that is, without an intervening period of normal brain function. Status epilepticus is characterized by tonic-clonic conversions that may cause irreversible brain damage or even death. We can diagnose by using electroencephalography and magnetoencephalography to locate the affected area of the brain. The seizure disorders can be controlled by anti-epileptic medications. Parkinson's disease, aka shaking pulse. This is a progressive neurological disorder affecting the portion of the brain responsible for controlling movement. As neurons degenerate, the patient develops uncontrollable nodding of the head, decreased speed of movement, and bradykinesia or hypokinesia, tremors, large joint stiffness, and shuffling gait. Muscle rigidity causes facial expressions to appear fixed and mask-like with unblinking eyes. Parkinson's disease exhibits pill rolling, in which he or she inadvertently, without intention, rubs the thumb against the index finger. Dopamine, a neurotransmitter that facilitates the transmission of impulses as synapses, is lacking in the brain. The treatment is the administration of L-Dopa, which can cross the BBB. L-Dopa is converted in the brain to dopamine. It only reduces symptoms. It is not a cure for Parkinson's disease. Multiple sclerosis, MS, is a progressive degenerative disease of the CNS. It is characterized by inflammation, hardening, and finally loss of myelin, demyelination, throughout the spinal cord and brain. As myelin deteriorates, the transmission of electrical impulses from one neuron to another is impeded. In effect, the conduction pathway develops short circuits. There are several signs and symptoms for MS: tremors, muscle weakness, and bradykinesia. Visual disturbances exist. During remissions, symptoms temporarily disappear, but progressive hardening of myelin areas leads to other attacks. Ultimately, most voluntary motor control is lost, and the patient becomes bedridden. The etiology is unclear, but autoimmune disease or a slow viral infection is believed to be the most probable cause. Alzheimer's disease is a progressive neurological disorder that causes memory loss and serious mental deterioration. Small lesions called plaques develop in the cerebral cortex and disrupt the passage of electrochemical signals between cells. Clinical manifestations are memory loss and cognitive decline. Also, decline in social skills and ability to carry out activities of daily living can occur. Also, there are personality, emotional, and behavioral changes. As the disease progresses, loss of concentration and increased fatigue, restlessness, and anxiety can occur. It is identified as a leading cause of senile dementia. There is no specific treatment. Moderate relief has been associated with medications that prevent a breakdown of brain chemicals required for neurotransmission. Mental illness is an array of psychological disorders, syndromes, and behavioral patterns that cause alterations in mood, behavior, and thinking. Psychosis is a serious mental disorder commonly characterized by false beliefs despite overwhelming evidence to the contrary, delusions. Typically, they can feel, hear voices, and hear voices and see visions in the absence of an actual stimulus, which is called hallucination. Speech is usually incoherent and disorganized, and behavior is erratic. Neurosis is a mental disorder caused by an emotion experienced in the past that overwhelmingly interferes or affects a present emotion. For example, a child bitten by a dog may show irrational fear of animals as an adult. There are several types: irrational fears, phobias, exaggerated emotional and reflex behaviors, hysterias, or irrational, uncontrolled performance of ritualistic actions for fear of a dire consequence, which is called obsessive compulsive disorder. Many psychological disorders can be effectively treated or managed by family physicians, school psychologists, marriage counselors, family counselors, and even support groups such as grief support groups and Alcoholics Anonymous. Diagnosis and treatment of serious mental disorders usually require the skills of a medical specialist called a psychiatrist. In the capacity of a physician, the psychiatrist is licensed to prescribe medications and perform medical procedures not available to those who do not hold a medical license. Psychiatrists commonly work in association with clinical psychologists who are individuals trained in evaluating human behavior, intelligence, and personality. There are common terms associated with mental illness. Affective disorder is a psychological disorder in which the major characteristic is an abnormal mood, usually mania or depression. Anorexia nervosa is an eating disorder characterized by a refusal to maintain adequate weight for age and height, and an all-consuming desire to remain thin. Anxiety, psychological worry disorder, characterized by excessive pondering or thinking. What if? ADHD, attention deficit hyperactivity disorder, is the disorder affecting children and adults characterized by impulsiveness, overactivity, and the inability to retain focus on tasks. Bipolar disorder is mental disorder that causes unusual shifts in mood, emotion, energy, and ability to function. It is also called manic depressive illness. Lamia Nervosa is eating disorder characterized by binging, overeating, and purging, vomiting, or a use of laxatives. Depression is the mood disorder associated with sadness, despair, discouragement, and commonly feelings of low self-esteem, guilt, and withdrawal. Panic attack is sudden, profound, overwhelming feeling of fear that comes without warning and is not attributable to any immediate danger. Oncology. Intracranial tumors can arise from any structure within the cranial cavity, including the pituitary and pineal glands, cranial nerves, and the arachnoid and the Pia Mater, leptomeninges. Most intracranial tumors originate directly in brain tissue. They may be the site of metastatic spread from primary malignancies that occur outside of the nervous system. Metastatic tumors of the cranial cavity tend to exhibit growth characteristics similar to those of the primary malignancy, but tend to grow more slowly than the parent tumor. Metastatic tumors of the cranial cavity are usually easier to remove than primary intracranial tumors. Primary intracranial tumors are commonly classified according to histological type and include those that originate in neurons and those that develop in glial tissue. There are signs and symptoms for brain tumors, like headaches, especially upon arising in the morning, during coughing episodes, and upon bending or sudden movement. Occasionally, the optic disc in the back of the eyeball swells, papilledema, because of increased intracranial pressure. Also, personality changes, depression, anxiety, and irritability can develop. We can make a diagnosis by using CT and MRI. Surgical removal relieves pressure and confirms or rules out malignancy. Usually, it requires radiation therapy (RT) as a second line of treatment, and chemotherapy when added to RT, and it provides the best chance for survival and quality of life. Diagnostic, symptomatic, and related terms. Agnosia. Agnosia means inability to comprehend the auditory, visual, spatial, olfactory, or other sensations even though the sensory sphere is intact. Asthenia is weakness, debility, or loss of strength. Ataxia is lack of muscle coordination in the execution of voluntary movement. Aura is premonitory awareness of an approaching physical or mental disorder, peculiar sensation that precedes seizures. Autism is one of the mental disorders characterized by extreme withdrawal and an abnormal absorption in fantasy, usually accompanied by an inability to communicate even on a basic level. Cerebral palsy is self-limiting paralysis due to developmental defects in the brain or trauma during the birth process. Clonic spasm is alternate contraction and relaxation of muscles. Closed head trauma is injury to the head in which the dura mater remains intact and brain tissue is not exposed. Coma is abnormally deep unconsciousness with the absence of voluntary response to stimuli. Concussion is transient loss of consciousness as a result of trauma to the head. Dementia is the broad term that refers to cognitive deficit, including memory impairment. Dyslexia is inability to learn and process written language despite adequate intelligence, sensory ability, and exposure. Guillain-Barré syndrome is the condition of acute polyneuritis with progressive muscle weakness in extremities. Herpes zoster, painful acute infectious disease of the posterior root ganglia of only a few segments of the spinal or cranial nerves. It is also called shingles. Huntington chorea is inherited disease of the CNS that usually has its onset in people between ages 30 and 50. Hydrocephalus is accumulation of fluid in the ventricles of the brain, causing thinning of brain tissue and separation of cranial bones. Lethargy is abnormal activity or lack of response to normal stimuli. It is also called sluggishness. Psychosis. Neurosis is unconscious conflict that produces anxiety and other symptoms and leads to maladaptive use of defense mechanisms. Psychosis is major emotional disorder where contact with reality is lost to the point that the individual is incapable of meeting challenges of daily life. Spina Bifida, meningocele, myelomeningocele. This shows spina bifida. Paraplegia is the paralysis of the lower portion of the trunk and both legs, usually as a result of injury or disease of the spine. Paresthesia is the sensation of numbness, prickling, tingling, or heightened sensitivity. Poliomyelitis is inflammation of the gray matter of the spinal cord caused by a virus, commonly resulting in spinal and muscle deformity and paralysis. Quadriplegia is the paralysis of all four extremities and usually the trunk. Reye syndrome is acute encephalopathy and fatty infiltration of the brain, liver, and possibly the pancreas, heart, kidney, spleen, and lymph nodes. Usually seen in children younger than age 15 who had an acute viral infection. Sciatica is severe pain in the leg along the course of the sciatic nerve felt at the base of the spine, down the thigh, and radiating down the leg due to a compressed nerve. Syncope. Temporary syncope is temporary loss of consciousness due to the sudden decline of blood flow to the brain. It is also called fainting. TIA, transient ischemic attack, is temporary interference with blood supply to the brain, lasting from a few minutes to a few hours. EEG, electroencephalography, is recording of electrical activity in the brain, whose cells emit distinct patterns of rhythmic electrical impulses. EMG, electromyography, is recording of electrical signals that occur in a muscle when it is at rest and during contraction to assess nerve damages. Lumbar puncture is a needle puncture of the spinal cavity. MEG, magnetoencephalography, is non-invasive test that records electromagnetic activity produced as neurons discharge and maps their pathway through the brain. NCV, nerve conduction velocity, is the test that measures the speed at which impulses travel through a nerve. CSF analysis, cerebrospinal fluid analysis. Angiography is the radiography of the blood vessels. So cerebral angiography. Myelography is the diagnostic radiological examination of the spinal canal, nerve roots, and spinal cord after injection of contrast medium into the spinal canal. Scan, brain scan, computed tomography or PET, positron emission tomography. Ultrasonography, echoencephalopathy. Cryosurgery is a technique that exposes abnormal tissue to extreme cold to destroy it. Cryosurgery. Cryo means cold. Stereotactic Radiosurgery. This is a precise method of locating and destroying sharply circumscribed lesions on specific tiny areas of pathological tissue in deep-seated structures of the CNS. It is also called the stereotaxy or stereotactic surgery. Thalamotomy is partial destruction of the thalamus to treat intractable pain, involuntary movement, or emotional disturbances. Tractotomy is a transection of a nerve tract in the brain system or spinal cord. Trephination is the technique that cuts a circular opening into the skull to reveal brain tissue and decrease intracranial pressure. Vagotomy is interruption of the function of the vagus nerve to relieve a peptic ulcer. Pharmacology. There are several drugs used to treat neurological and psychiatric disorders. Analgesics like aspirin, acetaminophen, and so on. Anesthetics as lidocaine, nitrous oxide, and so on. So there are two types, general anesthetics and local anesthetics. And anticonvulsants, they are used to treat seizures. Anti-Parkinsonian agents are levodopa. Hypnotics and antipsychotics, antidepressants, psychostimulants. Okay, lastly, abbreviations. AD, Alzheimer's disease, ALS, amyotrophic lateral sclerosis. ANS, Autonomic Nervous System, CNS, Central Nervous System, CP, Cerebral Palsy, CSF, Cerebrospinal Fluid, CT scan or CAT scan, Computed Tomography scan, CVA, Cerebrovascular Accident, EEG, Electroencephalogram or Electroencephalography, ICP, Intracranial Pressure, LOC, Loss of Consciousness, LP, Lumbar Puncture, MEG, Magnetoencephalography, MRA, Magnetic Resonance Angiogram or Angiography, MRI, Magnetic Resonance Imaging, MS, Musculoskeletal, Multiple Sclerosis, Mental Status or Mitral Stenosis, NCV, Nerve Conduction Velocity, PET, Positron Emission Tomography, SNS, Sympathetic Nervous System, TIA, Transient Ischemic Attack. Okay, in the next video, I'm gonna talk about special sensory system. See you again.